trance and help them speak your mind. In Jesus' name we have prayed. Amen.
Amen.
Amen. Amen. Thank you very much. Today's call is a special one because we have two amazing speakers who are in the medical field, and their goal is to help us overcome our tendencies to self-medicate, which seems to be a Nigerian thing. You know, maybe because we feel we waste hospital, whatever our reasons are, we need to understand that is not ideal. I'll read the profile of both speakers and then I'll welcome the first Adetutu to take her own segment. So I'll start with Adetutu's profile. Adetutu Adeyemi is a clinical pharmacist with a strong foundation in both hospital and retail pharmacy practice. She brings a wealth of clinical expertise with a passion for providing patient-centered care and improving medication safety. Her professional journey is marked by a commitment to excellence and compassionate service. Tutu has a certification in leadership and management in health from the University of Washington, a distinction that reflects her drive for contemplative strategic healthcare leadership. Her transition from hospital-based clinical care to the retail sector demonstrates her adaptability and broadening her impact on patient health and well-being. Beyond her professional life, Tutu is a lover of children. She's an active volunteer in her local church's children's department, where channels her dedication to nurturing the next generation. Inspired by her love for storytelling and creative expression, she aspires to become a content creator, focused on producing inspiring child-centered media and empowers young lives to flourish in the purpose God has for them. Isn't that amazing? She's balanced pharmacy with tech, with being children's teacher. It's a great deal, and I think we should talk at this call. I'll read the citation of the next person. Eseoghene Ojuederie, Compliance and Regulatory Affairs Manager with extensive experience in the pharmaceutical and medical device industries. He holds a Bachelor of Science in Physiology and a Master's in International Pharmaceutical Business Management. Ese is passionate about women's health and wholeness. She's a co-founder of Flourish, a Christian group for women in Dublin, Ireland. Ese is a daughter, a sister to 3 brothers, a publishing woman, bestie with a cool voice. Sisters, this evening, we have these amazing ladies here to talk to us about medication. Please welcome our first speaker, Adetutu Adeyemi, as she takes 2 in. Welcome, Adetutu.
Good evening, sisters.
Good evening.
Thank you very much for having us. Please, can you share the slide, Sister Toyosi?
Yes.
I love how you started with, your own history of self-medication. And like you said, I won't say actually a Nigerian thing, I'll say it's a human thing because it's not just streamlined to we Nigerians, even those from the Western world. So for instance, my friend was giving me a story about how a lady who, so she's on opioids, right, for pain management, and she used to abuse those things. So, and she's under NHS, right? So now she has a prescription for 2 months, so that because of the workload, right? So they always give them enough to take them for 2 months. She was not trying to play smart, and then came and told her that, she's moving from London to Wales, and because of that, she needs more. Meanwhile, she knows that it's still the same system that would operate in Wales and the one that operates in London. If not because obviously they have a system that works well, they would have, maybe for somebody that was unaware, might have fallen for her trick and then giving her extra doses, and then she would just be self-medicating and just doing whatever it is she wants to do with the medication. So let's get into our conversation this evening. Thank you once again for having us. Please, the second slide. We're going to define what a medication is and then what self-medication is all about, because our conversation today is on self-medication. So like the slide says, a medication is a substance that is used to diagnose, to treat, to cure, to prevent diseases or medical conditions, which usually in the form of a pill. We can have it as a tablet, as a capsule, or a caplet, and it also comes in forms of liquids for children in particular. We have it in form of injectables also. We have what we call enemas for the rectum. We also have suppositories, and then we have what we also call pessaries, right? That's one usually inserted into the vagina. And then there are also creams that we apply topically on our skin, which is supposed to be applied on the site of, say, where the infection is or where the thing you're trying to treat is. But sometimes we see people who will now use topical creams. This they call the common ones are these triple action creams. They will go and mix it with their body cream and say they want to be fair. So Nigerians do a lot of things, and so medications are usually prescribed, or rather should be prescribed by a healthcare professional, and then we have them as prescriptions, as OTCs. OTCs can also be supplements, right? So we go to self-medication. Self-medication, which is what we're here to talk about, is a practice of self-diagnosing yourself without the advice of a healthcare professional. And then because you feel that, oh, I know my body very well. So, okay, it's just headache, right? It's just malaria. No, it's just the flu. So I know what I'm supposed to do. So the key word is that self-diagnose, which is not supposed to be. Okay, so sis, please, you can go to the next slide. So I wanted to give an example first, but let's still just stay on the definition. Now, why do people self-medicate? Why do we practice this thing? For most people, they'll just say it's a minor illness. Oh, I have malaria. And it's because, okay, the symptoms I have, I have a headache, my body is aching me, my joints are paining me. These are the classic symptoms for malaria, right? Because that's what is pretty common in Nigeria. And it's because, okay, most of us here, most of us on the call currently are based in Nigeria, right? And then you say, oh, it's just malaria now. There's nothing serious, or just a headache, so I'll just take paracetamol. So I love when Sister TOCI was talking about, just always giving her son PCM. Meanwhile, say for a child, the fever can mean different things. It can be a bacterial infection. It can even be a viral infection. So a child having fever is not always, it's just PCM. Sometimes, in fact, most times you need to probe further, and which is, take the child to the hospital to see a doctor, and then we have a situation whereby what you are experiencing is stress induced. Probably your body needs to rest, you need to take a break. And because stress mimics other symptoms, you might feel like, okay, I think I have an infection or whatever. Meanwhile, what you need, what your body needs is proper rest, proper hydration and things like that. But because it happened to me in the past now, so yeah, I would just go and take an anti-malaria, and the anti-malaria you're taking, they're not even taking the correct dose. What most people will do is they will start and then they feel better. Because the way these things work, okay, you take one dose now, you might just feel better. And that's because maybe that's not what was wrong with you, right? And you just say, I'm already okay, so there's no need to continue again. And then they keep it for next time, easy access to medication. Oh, there's a pharmacy close to the house. Now, okay, ideally, pharmacies should not just, dispense drugs without prescriptions and all that. Even though some of these things are OTCs, but fine. We're in a society whereby there's easy access to medication. And then even if you go to a pharmacy and they don't give it to you, they are what we call patent medicine vendors. Those ones, they're just there to sell markets. So once you go there, they will give you anything you want. Meanwhile, they are not supposed to be dispensing prescription medications. They are supposed to just dispense OTCs, over the counter, things you can easily get, things that are safe for you to use. But we find that in a country like Nigeria, which is lawless, there's no law. There's no law. Even when there is a law, it's not being followed, and they don't enforce the penalties for breaking the laws and things like that. So easy access to medication, like we said. Some environments, like rural areas, they don't have access to healthcare facilities. There are no hospitals. It's still an issue, in some areas where they don't have hospitals, and the primary healthcare centers can't even, manage the number of patients they have. So most people will just decide to, okay, let me go and take agbo, or I have this thing, I have one medication that maybe somebody gave me one time without checking the expiry date and things like that. So because they are feeling a certain kind of way, they just use that medication and say, what's it on here? I'm okay now. So because of the fact that they don't have access to proper healthcare facilities. So yes, that would also encourage people to self-medicate. Then some people say, oh, well, it saves me time and costs. I don't want to start going to the hospital where they will say I need to run some tests, and then I'm spending money and I'm doing all of that. Then I'll now go back and pay for consultation. Maybe the cheapest consultation you will find is 30K for maybe 30 million. Like, why would I want to spend that kind of amount of money when I can just, get the medication myself? Because I know what is wrong with me. I know my body better than any other person. Meanwhile, that's not the case. So that idea of, I'm trying to save money and saving myself time, well, to come back and, hit the person in the bum. Then this one, influence from family, friends, and the internet. I think this one, like Sister has mentioned this, how that, this is what I grew up doing. This is what my mother did. This is what my grandmother did. And so it just continues like that. When we have this symptom, this is what we take. When we have this illness, this is what we use. So I mean, it works then. Why won't it work for me now? And like we'll get into, what the symptoms you have is not the same thing that your grandma had or that mommy had, And then the internet now, everybody is selling everything. I saw a guy, it was even my auntie I saw it from. She was showing me that, see, they were selling triple action creams, examples are what we call hydrocot creams and the likes from Bat A, those are the common ones, Skinel. And this guy was saying, when you have this on your skin, use this one. And I was seeing the number of likes, 22,000 likes. I said, Jesus Christi, can you imagine? Some of this, what they don't understand is when they use these things, it's supposed to be for a particular illness, right? For maybe 3 to 5 days. But you see them using it for 10, 15, 20 days. And then their skin starts to change in color. Their skin is thinning, and they're wondering where this came from. Meanwhile, it was something they saw on the internet, somebody that was advertising one product for them. Because they don't want to go to the hospital, they don't want to see a doctor, they decided to use that cream. And now they're not facing something else. Please, let's go to the next slide. Still on why people self-medicate and then the short-term benefits of it. You say, it's convenient. It's convenient, it's just, the pharmacy is just beside my house. So why should I go to the hospital that is 2 kilometers away from the house? But you don't understand that the long-term effects of these things you're doing can build up and, can develop into a more serious health condition that you have just been maxing. Also, you feel empowered. Yeah, I mentioned that earlier. You're in control of your own health. Yes, you have a say in your own health, but you also need a healthcare professional to be able to put you in the right direction. The same way you're a professional in your own field, that's the same way the healthcare person is a professional in his or her own field. And then they know better. So it's not just that they're there to waste your time or to take your money, because that's usually the mindset of certain persons that, they just want to collect my money and that is it. But no, they know what they are doing. They did not go to school for 5 years, for 6 years, plus 1 year house job, internship, and NYSC, just to waste your own time. So still the same point about it being cost effective. Yeah, initially it might feel like it's cost effective. You might say, okay, I used Lonart for malaria in January. In fact, this is so a practical example. My mommy's younger sister, she was treated to malaria, and then I got them the medication, right? Because her test results showed that she had malaria. She had more than +1. Now, as a side note, we in Nigeria were in an endemic environment for malaria parasites. So most whenever you do a malaria test, if you live in Nigeria, there's a high probability that you have 1% of that parasite in your system. But it doesn't mean that your immune system cannot fight off that 1%. So it doesn't mean that every time you have malaria, no. So, but this one, she had malaria, like it was 3 pluses and all that. So I thought that this is the direction. You have to use 4 in the morning, 4 at night. I got the one that is 24 in it for her. So she now called me, say 3 or 4 months later, that daughter is not feeling fine. I said, okay, and what's happening? There's a lab close to my mom's house. Like, take her there and do the test. I said, no, don't worry. Now I still have the donuts from the last time. I'm like, I don't understand. How do you still have it? They're like, I did not finish using it. I'm like, Jesus is Lord. As in, the direction was on it. I explained to you. I spoke to you on the phone. I explained, like, this thing is for 3 days. 4 in the morning, 4 in the night. First day, so time. The next day, after like 12 hours, clinical. She's like, after she felt better, I said, oh God, what is this? This one is even my own family member that before we used to stay together. I'm always just seeing all these things, how that we have to use our drugs completely and things like that. But here we are, the Nigerianness in her did not allow her to prosper. So, after that situation, I just spoke to her and like, I'm sure, well, next time, hopefully she will listen, but whatever the case may be, please, next slide. So let's just get into the meat of our conversation, which is now the risks and health consequences of self-medication. Okay, so number 1 is incorrect diagnosis. So like I mentioned earlier, how that sometimes you might just be stressed. And then because the way stress is, in fact, stress can mimic malaria. It can mimic to an extent, even typhoid. Like sometimes you start to throw up, start to have tummy pain, and it is stress. Or it is something else. There was a story that was shared with myself and some of my colleagues about a year ago, 2 years ago. There was a lady who used to think she had ulcer, stomach ulcer. And so for every month, she would take the ulcer medication every month. I think this went on for about 6 to 8 months. I'm not sure of the timeline, And it turned out that what she had was stomach cancer. So because she was self-diagnosing herself and assumed that it was stomach cancer, I don't even think she even did what we call the H. pylori test to confirm if she had the ulcer, but she just believed that it was ulcer that was her problem. And so she had the wrong diagnosis. And then she was using the wrong drugs. Now, what she even had was something way bigger, stomach cancer. And so the idea of trying to save money has now led her to, the time she should have used to treat the stomach cancer, and maybe she won't be remission, she had worsened her situation and gotten to, I think at the time when we were sharing the story with us, she was in stage 4 already. So I'm not even sure if she survived it and everything. So that's an example of wrong diagnosis. One symptom is masking another. You have stomach pain and it is persistent. It keeps going and coming, Like you should try and probe, okay, what is happening? Why is this thing going and coming? Not just that, okay, it's the same thing. And a lot of people do this thing, even with headache. People will say, oh, it's just a headache. I'll take paracetamol. Okay, fine. You take paracetamol, but it's not going. How are you sure that it's not that you have high blood pressure? How are you sure that it's not a tumor? Because headache can mean different things. It's not every time that it's headache that is just simple, or it can even be migraine too, So these are things that we shouldn't just take lightly. So we shouldn't, diagnose ourselves wrongly. Please always seek, the advice of a doctor or even a pharmacist. Then the pharmacist will still direct you back to the doctor. Another example is drug interaction and wrong dosing. So wrong dosing is like the example I gave of my auntie who took an underdose to start with. On Thursday, somebody came to the pharmacy where I work, and it was like, oh, he's feeling weak. I like, yeah, now you have to, like, are you sure that what were you treating and all the likes? And it was like, oh, you just been treating malaria. Everybody, malaria, and typhoid. Me personally, when you come and meet me with all those things, I just look at you like, you're not even serious. Because if you have typhoid, you'll not be able to stand, you know. So it was not like that they gave him blood builder. So he took overdose. I'm like, He say yes. So that the reason is somebody told him that a doctor told her to take overdose a particular time. So I stopped in there like, hold on. Even if what you're saying is correct, now it was at a particular time, and there was a reason why they told her to take, you know, a larger amount of that blood builder. But your own case is different. You are taking the wrong dosing. Now tomorrow you come and say there's something wrong with your tummy because crystals are beginning to form because you're taking overdose of medication. Another example is vitamin C, the popular vitamin C. It's recommended that you take up to 1,000 milligrams per day. But we see some people. There was a story on the internet about a lady who died from vitamin C overdose. She was taking 2,000 milligrams daily. Even people that have bones, that sometimes they have to give them, they have to inject about 3,000 milligrams of vitamin C in the hospital. They are being monitored. Not talk about somebody's at home taking it because of skincare and other things, and then taking it in overdose. So wrong dosing is, you know, is a result of self-medication. Then drug interactions. We have, when we say drug interactions, we have drug-food interaction, drug-drug interaction, drug health condition interactions also. For instance, somebody who is asthmatic, you know, that's quite common. We have people who are asthmatic, and then they say they have a pain. There are some pain medications that they shouldn't take because they're asthmatic. It can aggravate the asthma. You know, we have people who are hypertensive. There are other medications they cannot take. So I always say, if you're going to go to a pharmacy, if you're going to see a doctor, especially maybe a new doctor who doesn't know your history, doesn't have your records, always state all your medications, especially if you're on routine medications, you know, always state, this is what I take on a daily basis, this is what I use. So that when they are recommending something for you, they don't give you something that will interact with your other medications or that will, you know, affect your health condition. Because we're seeing cases whereby, when I used to be in the hospital, the doctor will write something, and then when the person comes to the pharmacy, in conversations, find out, okay, you're treating this. And did you tell the doctor? And like, oh no, I did not. Or sometimes find the person to the doctor. So in that case, what we just do is, you know, we write on that prescription, send the person back to the doctor, and, you know, we're able to work it out, and then the medication is changed so that, because at the end of the day, the patient's well-being is our prime focus, not, you know, who knows what or who is better than the other. So these are the issues, drug interactions. So you don't just take a medication because I have it. No. Even if you can't access a doctor at that time, if anybody here is on any routine medication and then you want to start on something that is temporal, you can go on drugs.com, and check for drug interaction so that you're sure that what it is you're trying to take now does not interact with something else that you take on a daily basis. Because if you're treating high blood pressure, cholesterol, diabetes, and the likes, those ones are continuous. You're not going to stop those drugs because of this other thing you're taking for maybe 5 or 10 days. But what we can do is you can taper these things, you can space it, you know. So these are reasons why self-medications are very risky. Things like this, you know, that can worsen whatever it is that you're trying to treat, and then now give you something else that you're trying to prevent. Then we'll talk about drug resistance. You know, in the world currently, in the pharmaceutical world, they're not developing new drugs per se, you know. So an example would be with antibiotics. Nigerians in particular, and Nigerians in diaspora, you know, are all of them together are the problem of this country. We see people who, say you're traveling or you're relocating, you will now come to the pharmacy and buy stacks of antibiotics because you know that when you get there, what you find, you don't yet have health insurance and all that. You can't go there. And a drug that you get in Nigeria for, let's say, 15,000, in the UK without health insurance, or US or Canada, it's going to cost you about 500,000. It can be less or it can be more. You know, so because you're trying to play smart, you're like, no, I need to pack all these drugs and all that. And then you start to use them for wrong diagnosis, you know. And what we don't understand that you are building is what we call drug resistance. Now, people who will now be sick, they've never abused any drug in their life before, be it anti-malarials, these are using the common examples, or antibiotics. They've never abused these things before. But because somebody else in another location has been abusing these drugs, and these bacteria, the way we are developing, the way AI is expanding and all these things, it's the same way these microorganisms are changing too. They are adapting. So by the time somebody who now needs the antibiotics needs to use it, to not work for the person, then to not be like, the drug they gave me at the pharmacy is not working. Meanwhile, it is because of this community issue. Somebody else has abused, people have abused the drugs over time, and now it has not developed drug resistance. Even with malaria now, we don't have new drugs. And the ones we have, people have over abused it. And this same issue of drug resistance have developed, And then people who can now afford to buy the most expensive anti-malarials, how are this, antibiotics, how are they supposed to survive, especially when they're on admission? So, the point is that we should not only just think about ourselves alone and trying to do a quick fix solution. No, go the long route, please. Because don't just think of yourself, think about somebody else somewhere else who in whatever time they can have an accident, and then they will need to be put on antibiotics, and they will have to be now be increasing doses, changing medications and all these things, because what? The one that should have just worked easily cannot work again. And then the person wondering how come, people are wondering what's happening. And you're like, but I've never used the drug before. You don't have to use it. People will go to the labs and go and do sensitivity tests, to see what antibiotics will work for whatever infection they're trying to treat. And the results will come out and they'll be showing resistance. Then you can see they'll do sample of maybe 20 antibiotics. Only 2 would work. And this person has never used antibiotics in his or her life before. So it's because of the community effect of drug resistance, that has developed over time. Because like I said, these organisms, they are getting wiser. The way we too, our minds are expanding, we're creating things. That's the way they're adapting, and they're changing their form and all that. Another point is delayed treatment of serious illness. Like the lady I mentioned that had stomach cancer, and then she was treating a stomach ulcer, and the money they were trying to save, you will now start spending that money in chemotherapy and every other thing. And that's just one example. There are different things. Some people with the minor headaches, meanwhile, it was a tumor the person had, and the person has been just filling himself with, filling him or herself with painkillers. The common one is paracetamol. And then some people, in taking the paracetamol, they take it in overdose. And what they don't understand is, as you are taking overdose of paracetamol, you are killing your liver. Then the next thing they'll say, oh, there's liver cirrhosis, there's liver this one, hepatitis has entered the matter. So in trying to manage one small illness, over time, that build-up has now caused something else. Okay. Another point is dependence and addiction. With people who self-medicate, like the lady I mentioned in UK, obviously she is now she's already an addict to opioids, and that's an issue they have in the UK in particular. People are addicted to opioids and all that. Even here too, we have them plenty here in Nigeria. There's a story that I saw recently, although this one, it's not that she herself was self-medicating, it was the negligence of a doctor. So there are drugs that we call corticosteroids that used to treat inflammation. And then this young lady had what we called abdominal obstruction. And that obstruction, part of the symptoms she was having is inflammation on the inside. So she was placed on an injection. Now, this injection, ideally, should be used once in 3 weeks. In some cases, once in 6 weeks, depending on the condition. For whatever reason, this so-called doctor placed her on daily usage of this thing. So you can imagine, I'm supposed to use something once in 3 weeks, and I'm using it every day. And so this went on for about, say, 2 months. And so a lady that was weighing 72 kg, because part of the issue with self-medication, and then in this example now, negligence from the healthcare person, is the side effects that come up from these drugs. When people self-medicate over time, they develop serious side effects that we have also mentioned here. So from weighing 72 kg, in a space of 2 months, she added 58 kg. That's 130 kg. Then she developed high blood pressure, diabetes. So the point is, taking one drug, abusing that drug, led to serious conditions. And now she has what we call Cushing's syndrome, because that's when you use corticosteroids for a long time, you abuse those things. We have people, Nigerians in particular, women in particular, who would take dexamethasone. That one is quite common. I think the local name is called Mau. And then they say they want to increase their bonbon. They don't have money for BBL and all that nonsense. So they start to take dexamethasone. And the side effect of corticosteroid, like I mentioned, one of the side effects is weight gain. So they start to add weight. And in their minds, I'm adding weight. And they're adding the weight in the right place, in the bum, in the breast, and all that. But then down the line, they develop high blood pressure. They develop diabetes. In another few months, another few years, there's kidney failure. And so the list is endless. So the point is, self-medication should be discouraged, not just for ourselves, but for our families, for our friends, for people that we'll just come across. Because it's not just affecting us or our own units alone. It affects other people who try to adhere to their own drugs, to their own prescriptions and all these things. But because others have abused these drugs, and like I said, you just are not being developed. And even if they are being developed, it will take years before, you'll get into the market and get into a place like Nigeria and all the rest. So we shouldn't self-medicate. Also, I'd like to mention how that we should always adhere to our prescriptions. So we are given a medication to use for 14 days. And they tell you, use it morning and night. It's not just morning and night. Please confirm. Okay, is it 12 hourly? Is it 8 hourly? Is it before meal? Is it after meal? Because when I talked about drug interaction, I said there's something called drug-food interaction, drug-body interaction, drug-drug interaction. So there's some drugs that you should use on empty stomach, some should be used with meals and all of that stuff. So you need to, you should always ask questions to it, especially for those of us, because I believe that most of us here, we do the right thing. So when you go to the hospital, you go to the clinic, you go to the pharmacy, they give you a medication, always ask. Also check, because in the case of this young lady that I used as the last example, if she had asked some questions from the beginning, she might not be in a current situation. Because self-medication, yes, is self-inflicted, but there's also the case where it's a doctor's negligence, it's a pharmacist's negligence that has caused people to even die. In the Western world, people get sued, like Dr. Chi said in the beginning. People get sued, they get arrested, their licenses are suspended and all that. Anyways, this doctor I mentioned is in Lagos here, but now his license has been suspended already. Not even because for this lady's case, but another case. So medication adherence too is also an important point to bring up when talking about self-medication. So if you're prescribed a medication, please adhere to the direction. If you don't understand it, always ask, because it is you that will take it. Even though we say, we're not trying to say you don't have, we talked about self-empowerment, like,
sorry, sis, can we begin to round off?
Yes. Sorry. So, ensure that, yes, when you're prescribed the medication, aside from the fact that, yes, we're not going to self-medicate, always ask, questions. Ask the doctor, ask the pharmacist. If you don't understand what it is they give to you, ask. Because at the end of the day, it is you taking the medication. It is your health. In as much as, yes, you're not supposed to self-medicate, but at the same time, you're not supposed to accept anything they give to you because, this doctor gave it to me, this pharmacist gave it to me. No, ask questions. So I'll stop here and then Ese will take over. Thank you very much.
Thank you so much, sis. Sister Ese, we're ready for you.
All right, thank you. Next slide. I think Tutu, this is your slide, but I'll just quickly maybe run through it. As Tutu was speaking, I was also collecting my cane because I remember back then when I used to take paracetamol a lot. If I have slight headache, I have any sort of pain, I would take paracetamol. And I noticed as I grew older, paracetamol was no longer working for me. And I was wondering why. Why was it not working? But I actually abused paracetamol growing up. And the role of a health professional. So for accurate diagnosis, for personalized medication plan, monitoring for side effects, and ensuring safer medication use and better disease management. So next slide, sis. Okay, medication safety and pharmacovigilance. What is pharmacovigilance? I'll just break that word down. So I would break it into 3 words. There's pharma, there's co, and there's vigilance. So it's like pharma collaborating with like a vigilante. And who is the vigilante? So that's you and I. Now your pharmacist or your doctor have given you a medication, you've started taking it. You're taking your medication, day after day. We'll still have a role to play because no medication is 100% safe for everybody. Now, it's just like a vigilante. They're like a watchdog, they're out there looking out for what's going on, for everyone's safety, ensuring everyone is fine, ensuring everyone is okay. Now, why do we need pharmacovigilance? Why do I, as a vigilante, need to collaborate with these pharmaceutical companies making these drugs? I don't work with them, do I? No, they're not paying me. I'm the one even paying them because I'm buying medications from them. So why do I need to help them? So why pharmacovigilance matters? It's because now when a medication is made, it goes through clinical trials whereby there are people that, these medications are tested on, but it's a very small sample size when it happens. Most of the information the pharmaceutical companies get is after this medication is in the market. And research has shown that even from the sample size they have, all demographics are not fully looked into. So it could be more Caucasians than more Africans. So let's say, okay, let me throw this question out there. If you travel to a new country, or even in Nigeria, if Enzo approaches you and be like, hi, Dr. Chi, or hi, Sister Kemi, we're working on this new product and we need volunteers, or we need people that we can try this product on. Would you volunteer? Will you agree? Will you raise up your hand and be like, I'm here? If you would agree, put it in the comment section. Because that's happened to me before, whereby when I got into college, they were carrying out research on a medication and they were asking for volunteers. I said, I know I never born. I'm not married. I don't have kids. I don't want trouble. So I refuse to volunteer. So most times, for different medications, they have a sample size. And sometimes we are not represented in those sample size. So it's when you take the medication, you begin to see different side effects that you've never seen before. And also historically, it's also been shown that women have more side effect on medications than men. So what can we do as individuals, as the vigilante? So you start taking your medication, you notice there's a side effect, you notice it's an adverse effect, you notice a sudden change. It doesn't matter how small it is. It could even be like a minor medication, like an antibiotics, like paracetamol or whatever it is. But you notice since I started taking this paracetamol, I've been having high fever, or I've been vomiting, or I've been feeling different. What do? You go back to your pharmacist or back to your doctor that prescribed that medication and you report it. You don't just say, okay, I'm feeling this way. Oh, it's working. That goes to show that the drugs is working. That's not always the case. If you feel different once you start taking your medication, immediately go back to your doctor, go back to your pharmacist and report it that this is how I'm feeling. since I started taking this medication. So this is you now collaborating with the pharma companies. And what happens is that your doctor or your pharmacist, when you are telling them, ask them, this information I'm giving you, hope you're writing it down. It's not just to come and complain. You can even ask, what will be done about this? Because what happens is that your doctor or your pharmacist can make a report to the pharmaceutical companies and be like, okay, my patient took this and this is what they are feeling. And this is where my circle comes in. So the pharma companies, they collect this information from the doctors, from the pharmacists, from the community health specialists. They review and assess. Because when they were actually carrying out the clinical trials, it was just maybe sometimes the trials is for like 3,000 people. And now this medication is out there and there's 1 million people taking it or 2 million people taking it. So that's now a larger sample size. It includes women, it includes children, it includes Asians, it includes Caucasians, Africans. That's a larger sample size. So they don't really have all the information initially when, these medications are made. So it's just like a post-marketing surveillance, but the pharma companies cannot follow every consumer to know, okay, since you started taking our paracetamol, what has been happening to you? They don't know. They don't know where all their consumers are. So this is where we collaborate with them. And like I said, I know they're not paying you, but it's for our own good because this information out there, it helps. So the pharma company, they review and assess this information, that these reports that have been made. Then they decide on what to do and they act. Okay, if 1 million people, if we have 1 million complaint of people saying, since they started taking our medication, they've been vomiting, what do we do? Do we withdraw the product? Do we change our ingredients? Do we change the active that we're doing? They carry out a review and they communicate this review out there. Okay, we are withdrawing this XYZ from the market. They put it out there. And they monitor. So it's a circle that goes round. But if, as a vigilante, we don't go back and we don't complain, the pharma companies, they will not know. They're making money. They're cashing out. We, the consumers, we are the ones suffering. They're not getting reports. They don't know. Somebody working there could know, okay, my brother complained or my sister complained. It should just be like, okay, maybe it's 1 out of 1 billion. But if they have 1 million, 1,000 people complaining, then the company can actually review on what to do. They can be like, okay, we can make changes. We can, it's up to the pharmaceutical company to decide. So as a vigilante, and I know for, most times for Africans, we don't have this reporting culture. It's like, even if your child complains or your child is vomiting after a medication, you'll be like, don't worry, you'll be fine. It's working. I think it's working. That's why this is the reaction, Or sometimes you feel like, if I report, what would be done? But, when there's a large number reporting and it's going to the doctors and the doctors or the pharmacists are going back, to the regulatory bodies or going back to the companies, like I believe that there's no way there will be a blind eye on that. And I will give us examples with that. So next slide, sis. Okay, so this is a practical example. You can go online to read about it. So there's this medication called Vioxx. It was made in 1999, and it was a medication that was put out there for painkillers and for arthritis. So, the pharmacy has prescribed, take 50 milligram, 200 milligram. No, the doctor has prescribed, the pharmacy has given it to you. They were taking their medications in 1999. And people realized that since they started taking this medication, they've been having arthritis, they've been having, increased stroke, vascular issues. They didn't keep quiet. People were reporting. They had thousands of reports. People were going back to their doctors. I was very okay, but since I started taking this medication, how come I'm having stroke? What happened? From where to where? But it's because people were reporting that it got back to the pharmaceutical company and they had to make a decision in 2004 to withdraw the product. But if nobody had complained, if everybody has been taking it, even though you're having heart attack, you're having stroke, you just be like, okay, maybe it's something else. Maybe I'm eating, maybe, it's a new food I'm eating, or maybe it's change of environment, or maybe it's old age, or there's something in the air. This one everybody's having stroke. It will not be my portion in Jesus' name. You know, if people took that approach, that drug might still be in the market today, 2025, causing more harm. So this is where, as a vigilante, you need to, mount your guard, be strong, open your eyes as you're giving your children medication, as you are taking your medication, your father, your mother, your friends. If there is a tiny side effect, encourage them to speak up, encourage them to report back to their doctors. Now, there's this popular one, I know most moms know about this, Johnson & Johnson's talc powder. It was popularly used in the 90s, in the early 2000s. Even females were using it for around the genital area. And it was discovered that years later, many women started complaining about ovarian cancer. Now, this is not a medication. It's not a prescribed medication. It's a powder, but it's made by a pharmaceutical company. And women started complaining and women started suing. They didn't keep quiet. It started in North America. And I think in early 2020, talc powder was withdrawn from North America, but it was still used in other countries, in other part of the world for a while until, it's when you complain, they will now say, okay, let's do something about it. But if you say you're fine, they will leave it out there now. So it was later on globally, this medication was withdrawn from the market. So in as much as we're taking our medications, they are prescribed, you need to also observe your body for any change when you're taking this medication. And when you observe any change, you speak up. You go back to your pharmacist, you go back to your doctor, you carefully state out, what you've been observing, what you've been feeling, and make sure they are taking notes. And if you also want, you can also ask for a follow-up. I know there are different countries with different policies on how it works. It depends on the country you reside in. Try to find out, this complaint I'm making, how far will it go? Where does it need to go to? And it helps. So we need to be vigilantes. We need to watch. And also, not just for prescribed medications, even for skincare, for different things that we use on our body. If there's any adverse effects, we need to learn that culture of reporting. Reporting is not that you're trying to spoil somebody's business. No, you are protecting people. Imagine if this Vioxx was still in circulation till 2025 because nobody reported. The amount of stroke, the amount of, heart attacks we would have seen in the last few years would have been major. So on the other side, for the pharmaceutical companies, they review, they look at all of this, but it's with the information that we, the vigilante, give to them. That's the pharmacovigilance. Us collaborating with the pharmaceutical companies and telling them that this particular medication, these are the side effects. Now, I just want to briefly speak about there's this medication that is going on out there, Ozempic. It's popular, it's good. It has its good, its positive effects. But recently, around the EU region, people have started reporting and giving other, upcoming side effects. And one that have stood out that the EU has put out there, these are things that you can go online and read about it, is that people are having suicidal thoughts. Now, it was not there before, and like I said, when they were making Ozempic and all of that, they might not get that side effect because of the small sample size. But now we have millions of people using Ozempic, if not billions. We are 8 billion people in the world, maybe up to that amount might be using it. So now people are reporting gradually. So with that information, different governments might have to maybe depend on their policy. They might suggest a dosage reduction. They might withdraw it from their market, whatever policy they deem fit. But this is because people have started reporting that this is how I feel since I've been taking this particular medication. So it's good to speak up. It's good to report. It's good to keep good contacts with your pharmacist and your doctor. And also when taking a medication, it's very good to read the leaflets. When you get a medication, you get the carton, it says the dosage, it says, it gives you other information. There's a section that always says side effects, contraindications. You know, when taking your medications, always look at that so that you can have more knowledge. If you're taking your medication and something else is happening to you, if it's similar to what's on the leaflet, at least you have an idea. But if it's something new, you know, you speak up and you interact with your doctor. So just in conclusion, just like Tutu talked about, self-medication sometimes seems harmless, but the long-term effects can prove otherwise. So consultation with a pharmacist or a doctor is always the best option. Pre and post your medication. All right, thank you, sis.
Thank you so much, sis. Thank you, sisters. Let's quickly take questions, then we'll get ready to get off the call. Question I have here. If one finds that their system or body is resistant to a number of antibiotics, how do you get it back to be sensitive?
Okay, so you can't get it back to be sensitive because once that become resistant, what will now happen is that they will have to use a different antibiotic, a higher one, you know. So that's really is what will happen. Once resistance has built in, there's nothing you can do about it. It is what it is.
Thank you, sis. The second one, this is directed at say, how long does it usually take for feedback to be received and changes made by a pharmaceutical company, especially with new drugs?
Oh, yeah, it depends on the company's policy. So most times when there's influx of a particular complaint or a particular medication, the pharmaceutical company try to act as soon as possible. I can't give a definite timeline because I've worked in different companies, so they have different times and how they respond to those issues. Or if it's in thousands or millions, they respond like immediately because they don't want to lose their license, they don't want to lose their market share, they don't want it out there. So sometimes as quick as 1 month or 2 weeks, you get information out there online. Most times or sometimes they do a recall. They just recall that product or that particular batch first. Then they go back to investigate and they bring out more information on that medication.
Thank you. Am I supposed to have a pharmacist I see like a PCP? I don't know. What's a PCP? Well, I guess the started to understand the question. Please go ahead.
You can, because especially when say you have children and then they're always on medications, with children, they always have 1 or 2 illnesses. So it's a good idea, even for you as a person too, especially when you're on a prescription, so you can always ask questions or if you notice anything. Sister Newton was saying something about her sons. I just like to say it could be that your other son reacts to what is inside the camustonate. So the combination, camustonate is a combination of 2 different medications, artesunate and amlodipine. So some people react to either of the 2. And that's why, he will have like a backlash and his brother is not having anything. So in that case, you use a different combination if you treat malaria next time and then not give him that same camustonate again.
Thank you. Okay, please help us define PCP for those of us who don't know what that one is. So what's a PCP or what's PCP? Did you hear that? What's PCP?
Oh, that's I've forgotten the full meaning, but that's your Esther Deborah, I've forgotten the full meaning, but that's like your own healthcare, your doctor.
Primary care physician, like GP.
Okay.
In UK, I think it's GP or something in UK, but it's primary care
physician. Okay, thank you. Do we have any other questions, please? Love and appreciation to our facilitators, the TOCI way. Please flood the charts. Tell them thank you. We appreciate you. We love you. Thank you for a fantastic session. Thank you, Star Deborah, primary care physician. So let's celebrate our speakers today. I'm sure we have learned something, right? So please go into the charts, tell them thank you, tell them well done, let them know we appreciate them. Thank you, Sister Tutu and Sister Ise, we appreciate you. We had quite an enlightening session today. Yes, it was a fantastic session. Our sisters are saying thank you. Thank you so much. Okay, Sister Deborah is saying we should do family planning. My dean is right here, Sister Malara, my one and only education dean. We have another topic, family planning. Thank you for an insightful session. Thank you, sisters. God bless you. Thank you, everyone, for joining tonight. I am sure that